Hello everyone, welcome to week 9. This week's topic is mental health. So within your modules it's topic 7. It gets a little confusing after mid-session break. Our topics no longer align with our week numbers and they'll be lagging 2 weeks behind. So we'll try to keep on top of it. If you ever are questioning where we're up to, check your study schedule on the left-hand navigation bar. So the readings for this week are chapter 7 from your textbook, as well as an additional online reading which you can find at the link on this slide. Firstly, today I wanted to talk about some of the historical trends in mental health. So from the 1770s to the 1900s, we really saw mental health trend being a moral treatment. So the emphasis was on institutionalization and those traditional asylums and that sort of thing throughout this time period. We then saw a shift from the 1900s to about early 1900s to about 1945 of mental hygiene. So the specialist psychiatric units and psychotherapy were all coming to the fore during this time, and there was less sort of just locking up and throwing away the key approach to mental health and more looking towards potential treatment for mental health illnesses. The third type trend we're going to look at is from the 1950s to currently, and that's the era of deinstitutionalization. So no longer we have those suffering from mental health illnesses locked up in asylums or being locked away. We see more a community care model of approach to care. So social workers have really been actively engaged in mental health practice, research and policy development since the mid-1900s. Initial social work involvement was psychiatric social workers within asylums, so in that institutionalized type setting. And the long-term commitment of social work within mental health is really that biopsychosocial model of practice. So we will be looking at that more in this lecture, but a really nice way to think about it, if that's a term that's new to you, is the bio is your biological, the psycho your psychological, and the social, of course, being all of the social elements of a person. The social context and social consequences of mental illness and disorder. So when we're looking at context, we're talking about social environment, which includes the individual personality, vulnerabilities, resilience, family functioning and support, strengths and stresses, support networks, economic well-being, as well as employment and housing. So all of those things within the social context for the individual. Social consequences in terms of mental health are impacts of their illness upon the individual, the family and community relationships, including violence and child protection issues, life chances and economic security and housing. So you can see how the consequences in the context overlap in quite an evident way as well. The purpose of social work practice within mental health is described by Bland in 2005 as to restore individual, family and community well-being and to promote the development of each individual's power and control over their own lives and to promote the principles of social justice. So you'll all see from assessment 1 that a lot of the things we talk about within fields of practice are really underpinned by those social work ethics and values. Again, you can see the approach of social work within mental health underpinned by that idea of social justice and of empowerment as well. Which segues nicely onto my next slide. I feel like sometimes I should look to my left while I'm speaking to see which slide's coming up. But as I said, social work values that underpin mental health social work practice are respect for the person, respect for the individual in lots of different ways, self-determination, as well as confidentiality. So a little bit more on those values that underpin practice. The idea that people are really much more than an illness or a diagnostic label. So already there you can see a shift from traditional views of mental illness as being something that the person needed to be locked away because the illness, and it was all encompassing and that's who they were. And it really, the way of thinking was that it really was all encompassing. Whereas now that from a social work perspective, we can see that individuals are so much more than diagnoses or so much more than a label that may be put upon them. Individuals have broad needs beyond specific treatment needs. So a contemporary social work perspective on mental health is that, yes, we do need to treat the mental health issues for the person, be that through medication or counselling, but the individual is so much more than that. They've got a lot of other needs and concurrent issues and interests that we need to think about from a social work approach to mental health. Social workers really stress personhood rather than patienthood. So working from that client-focused, person-centered direction. Patient in itself is a label that can be quite, I guess it has a lot of power and a lot of powerlessness for a patient. So we like to think of the clients we work with as people rather than patients in that sort of submissive notions that are tied into that word's patient. The importance of family and relationships beyond the concepts of carer. So the importance of really harnessing and embracing supports for the individual above and beyond those of carer. So sometimes within mental health practice, we might ask someone, who are your supports, or who do you have around you who can help you when you're having an instance where your mental health isn't great or you're feeling unwell. And we quite often talk about supports in terms of more of a carer role, but it's really important when looking at working from an approach that's empowering and considers personhood, that we think about others in more than a caring capacity for those with mental health issues. The policy context. So the National Mental Health Strategy aims to promote mental health, prevent mental health problems, reduce impacts of mental illness on individuals, families and the broader community, as well as assure rights of people with mental health issues, and the another word that I stumble over, but really harnessing those consumer and carer voices as central to practice. The underlying principles of this policy are that services should be multifaceted, and also that work should be undertaken within multidisciplinary teams, and a multidisciplinary approach is really at the core of good mental health care practice. People with mental illness have the same rights as other people. Seems really evident, but history and continued contemporary approaches sometimes negate the rights of those with mental health issues. Or at least impinge upon. Community and individuals have a justifiable right to protection, positive outcomes for consumers, priority to severe mental illness and disability, consumer participation decision making, again that client-focused, person-centered approach, and strong support for carers and advocates as well is a really important underlying principle of this policy. So participation is probably one of the core issues for consumers and carers in mental health. It's a right, and full information and involvement in planning, delivering and evaluating services is a participation right. It encourages better services. It strengthens accountability and responsiveness to consumers and carer needs. It's really important that we are encouraging consumer and carer participation within mental health. Effective social work within mental health requires a knowledge which is sort of far greater than knowledge bases that you will get in your study of the Bachelor of Social Work, or your study in social sciences welfare, or your study in any uni degree. Social work knowledge in mental health is really one of those things that you develop, and it's ongoing throughout your life and throughout your studies. So you do require a knowledge of psychiatric disorders, treatment and prognosis, medication and side effects. I know for students going out on their first placement as social work students at the uni, one of the biggest things they find in community health-based mental health placements is getting their head around all of the medication and the terminology, and they can spend a great bulk of their placement just familiarising themselves with those things. Legislation, for example, involuntary admissions into hospital and knowledge around what the legislative requirements are. knowledge of community resources, including income support, accommodation, referrals. There could be a whole lot of community resources that would be really applicable for someone that you're helping for mental health issues. And as I said at the start of the lecture, there can be a lot of concurrent issues for people suffering mental health issues, whether they be child protection or housing or income support related. Ability to advocate for clients, to be assertive, to appreciate the contribution of social work to multidisciplinary teams, and to have good counselling skills. So that one's a little bit of a multifaceted point there that I've made. But advocacy, of course, as a core skill social workers bring to mental health. We need to be assertive, and we really do need to appreciate the role that we play within those multidisciplinary mental health teams. I think quite often social workers can sometimes take a back step to those who may be working within the medical model or those who may have a more overt role with the client, but we really need to be advocating, and we are the client's advocate quite often in mental health, so we need to be really assertive within our role and stand up for the role of social work and working in mental health, and of course have really good counselling skills and listen to the client. I mean, they're in a position where they may not have a lot of power, and they're in a position where not many practitioners may be listening to them. So it's really important that we come from a standpoint of acknowledging the importance of that. We need to balance the rights of the consumer and community needs. So this is something that's really interesting to me, in that I'm a strong advocate for the client and for client rights. However, we also do need to consider community need. And what does that mean? So some ethical issues in terms of working in mental health as a social worker are ideas related to social control, to restore and maintain as possible the power of individual over their own lives, which can become problematic in this sector. I'd love to hear some ideas from those of you who are engaged or have had involvement with the mental health sector of what that looks like, and potentially talking around the powerlessness that can be felt by those who are within the system. Self-determination. We need a justification for treating people against their will, issues of competency in acute episodes of mental illness, and maximising self-determination for individuals. We need to think about, again, the individual, family, community needs and rights, and the potential for competing needs and rights and conflicts there. And that's where we come into some ethical dilemmas in this field and things that may not be black and white, where there's a bit of a grey area around these things. Again, coming back to our code of ethics, there's a really important basis for professional decision making. Where there is areas that are unclear or decisions that are difficult to make, what does the code of ethics say what we should do in this situation? So, as many of you may be aware, through Medicare you can actually access allied mental health professionals. So they include registered psychologists, accredited occupational therapists, as well as accredited mental health social workers. There's a link down the bottom there for more information about the Medicare Mental Health Professional Access Scheme. And on this next slide, I'm just going to explain a little bit about what an accredited mental health social worker is. So accredited mental health social workers have a breadth of experience in assessing and working effectively with those experiencing mental health issues. The way in which an individual becomes accredited as a mental health social worker, it is a fairly complex process, and it's through the ASW. So please, I've popped a link down the bottom there for more information on what an accredited mental health social worker is. And as I mentioned, the ASW is the accrediting body, and once you are accredited, you can get onto the Medicare scheme and work within that realm as a mental health social worker. However, that's not to say that many social workers who are not accredited mental health social workers do not work within the field of mental health. I think mental health is one of those sectors that really crosses across many fields of practice, and can be underpinning lots of different job roles and contexts, as well as those who work directly in mental health but are not accredited mental health social workers. I think they make up probably the bulk of the mental health social work workers. But I hope today has given you a little bit of an overview. Please engage with the forums if you have any questions or if you have anything to add or discuss in terms of this topic. I've popped some references on the last page here, and it's been lovely speaking to you. I'll talk soon. Bye.